Today I presented some data about the feasibility of detecting microRNAs in nipple aspiration fluid samples. Nipple aspiration fluid samples are quite challenging. We obtain them non-invasively by aspiration under vacuum using a pump system that is similar to what's used for breastfeeding. And we generally get only a few droplets of NAV, so 10 to 20 microliters, so the sample volumes are really low. And we want to use NAV samples as a means to predict breast cancer development at a very early stage. So basically as a new screening tool for breast cancer. And we think that this might particularly be interesting for women carrying a BRCA1 or 2 mutation, because these women have a 6 to 8 times higher risk of developing breast cancer, and they often develop the disease at young age and with a more aggressive phenotype than usual. And up to 55% of these women will not develop breast cancer before the age of 70, but nevertheless, many of these women opt at very young age, so around the age of 35, for prophylactic bilateral mastectomy, the preventive removal of both breasts, which of course is a mutilating and psychologically distressing procedure. So by exploring a novel way to study the breast microenvironment based on the detection of microRNAs in these nipple aspiration fluid samples, we hope to be able to find a new way to predict breast cancer development at a very early stage. Well, so far we've only done like a small pilot, and we found some significantly dysregulated microRNAs in the cancer setting, but the sample size was too small to really conclude something about it. But at least we found already a few interesting microRNAs. We need to expand the experiments. Basically what I talked about today was more the feasibility of detecting these microRNAs in NAV, and more basic things we need to know, such as how do these microRNA patterns fluctuate in time? Because if we want to use them as a biomarker, we don't want them to fluctuate too much during menstrual cycle, for example. And I also demonstrated that the fluctuation is quite acceptable. We look at microRNAs using qPCR, and we've tested different platforms because I already mentioned detecting microRNAs in these limited NAV samples is quite difficult. So we've compared different platforms, and we've now selected the most sensitive one. And that's how it works. And we chose to look at microRNAs because they are tiny RNA molecules that can influence gene expression, and they are known to play a role in carcinogenesis. And they have been shown to be dysregulated in many cancer types, including breast cancer. And these microRNAs are released into biofluids, and it has been shown that the release of these microRNAs by tumor cells into the corresponding biofluids is selective, and therefore they may correlate to malignancy. So that's why we focus on microRNAs. Well, we've now demonstrated that microRNA expression analysis in these limited NAV samples is not only feasible but also highly reproducible. And this was just the first step moving forward to a larger biomarker discovery study. We've started collecting NAV samples from women carrying a BRCA1 and 2 mutation, and also other women that are at increased risk of developing breast cancer. We started collecting these samples already back in 2008. So far we've included 600 women, and we're still including at the moment, and we obtain NAV and blood from these women each year and follow them up for 10 years. So part of these women will develop breast cancer during follow-up, and it will be interesting to look at microRNA levels in these samples while these women are developing breast cancer. And in that way we will be able to find a biomarker, a microRNA biomarker panel that can predict breast cancer development at a very early stage. Many researchers have looked at microRNA expression in blood, and there have been some systematic reviews comparing microRNAs that were found to be dysregulated in blood samples in those different studies. But it has been shown that none of these studies actually find the same microRNAs. So I think that is a big problem when using blood. It's not very specific. You can also have a microRNA change when you have an inflammation somewhere in your body or something else. And we believe that using the fluid from the source will be the solution.